Welcome to this video on macrovascular disease and diabetes. This YouTube video is about the enormous challenge we are facing today from macrovascular disease and diabetes. Before I start talking about macrovascular disease, however, I would like to give you some historical perspective of how diabetes management has evolved over the last 100 years, and why I am referring to macrovascular disease as the second front in the war against diabetes. It is almost 100 years since insulin was first isolated in 1921 by Banting and Best from dog's pancreas. Before insulin, diabetes was regarded as a death sentence. Death usually occurred due to acute complications, particularly diabetic ketoacidosis or infection. Children with diabetes, when given insulin, put on weight and became well again, as can be seen in the dramatic before and after pictures in this slide. After insulin could be produced in sufficient quantity to come into widespread use, acute complications dwindled drastically. There was a wave of optimism bordering on euphoria, with Dr. Frederick Allen confidently stating in 1930 that diabetes had been conquered, and every diabetic could now expect to live out a normal lifespan. However, as diabetics started to live longer, they began to develop vascular complications, which were rarities in the pre-insulin era. So diabetes had morphed from a frequently fulminant incurable condition to a chronic lifelong disorder. The war against diabetes had not been won after all, merely the first battle. Vascular complications were of two distinct types: micro and macrovascular. Microvascular disease affects the small to microscopic blood vessels that supply the eyes, nerves and kidneys. Damage to these vessels can result in loss of vision, kidney failure and loss of feeling, particularly in the legs and feet. Microvascular disease only occurs in diabetics and is not present before the onset of diabetes. It occurs in both type 1 and type 2 diabetes. Macrovascular disease affects the walls of the large and medium-sized arteries that supply blood to the body. Most importantly, it is these arteries' job to supply the heart muscle, the brain and the arms and legs with oxygen. Due to a process called atherosclerosis, they can gradually narrow and can eventually block completely. Unlike microvascular disease, anyone can get macrovascular disease. Macrovascular disease also occurs more frequently, earlier and progresses more rapidly in people with diabetes. It could already be present when the patient is first diagnosed. How does macrovascular disease affect a diabetic person? Diabetes increases risk of macrovascular complications occurring from 14% in a non-diabetic person to 54%. If it affects the arteries that supply the brain, it can cause a stroke. If it affects the coronary arteries of the heart, it can cause angina, a heart attack, or heart failure. If it affects the peripheral arteries, it can cause claudication, that is pain on walking, ulcers, or amputation. It can cause death. Macrovascular disease is now the commonest cause of death for diabetics. 75 to 80% of diabetes mortality is attributable to the three major forms of macrovascular disease complications. Macrovascular disease has numerous other risk factors which contribute to the overall risk in diabetics and non-diabetics alike. These include age, smoking, high blood pressure, high cholesterol, in particular LDL cholesterol, known as the bad cholesterol, protein in the urine, obesity, family history, and certain races. To continue with our diabetic history, an association between the complications of diabetes and elevated blood glucose levels was postulated in the early part of this century. A great debate raged for 40 to 50 years among eminent diabetologists. Could intense glucose-lowering treatment reduce vascular complications? Some argued yes, others no, that they were just an inevitable part of diabetes. It wasn't until the last 3 decades of the 20th century that high blood glucose was linked conclusively with the development of diabetic complications, and that the risk of some complications could be reduced by more intense blood glucose control. A series of large-scale randomized control studies were undertaken in the 1980s to 90s to attempt to answer the question: could vascular disease be prevented by controlling blood glucose? The Diabetes Control and Complications Trial (DCCT) 1983-93 compared standard control of blood glucose to intensive control in patients without complications with type 1 diabetes. It showed that improved glucose control reduces microvascular complications. The United Kingdom Prospective Diabetes Study (UDS) between 1977 and 1991 in newly diagnosed type 2 diabetics showed the same result. However, neither showed a conclusive reduction in macrovascular complications. Follow-up studies on the same patients after the trials ended showed a legacy effect. The patients who had their glucose controlled intensively benefited years later with less macrovascular complications. These trials also showed the benefits of blood pressure and cholesterol control in reducing risk, as well as benefits of oral medication, particularly metformin. 3 further trials, ACCORD, ADVANCE, VATE, were done looking at the question this time of whether even more intense glucose control, as close to normal as possible, would give better results. The patients in these trials already had macrovascular disease. Unfortunately, this more intense control resulted in an increased risk of hypoglycemia and mortality. This led to the recommendation, that still stands today, that glucose control needs to be individualized. The glucose target can be less or more stringent than average, depending on disease duration, life expectancy, comorbidities, existing vascular complications, patient preference and patient supports. It is now known that high blood glucose levels can cause injury to the lining of the artery wall. This allows LDL cholesterol to penetrate the wall, building up deposits called plaques. Other risk factors such as smoking and high blood pressure also contribute to this process called atherosclerosis. The STENO-2 study showed that improving control of glucose levels, LDL cholesterol and blood pressure led to a 50% reduction in cardiovascular mortality among patients with type 2 diabetes. In fact, treatment of LDL cholesterol and hypertension appears to be more effective than does treatment to lower blood glucose levels. As a result of these and other findings, the treatments available for patients with diabetes have improved dramatically over the past 30 to 40 years. In a parallel universe, the battle with macrovascular disease was also being fought, but this time for the whole population, and battles were being won. A new drug type called statin was developed that could shut off the liver's production of cholesterol and significantly reduce bad cholesterol, LDL, in the blood. But would they work in diabetes, where the risks were higher and the disease more aggressive? The trials confirm that they would. Although diabetes is a serious disease, risk and benefit must be considered at the same time for any treatment. When researchers combined information from 13 studies involving a total of 91,140 patients, they found that treating 255 patients with statins for 4 years led to 1 extra case of diabetes. However, at the same time, 5.4 cardiovascular events were prevented. Therefore, although the risk of diabetes is higher in patients receiving statins, statins ultimately benefit people with established heart disease or risk factors for heart disease. More importantly, the strongest predictors of whether a patient will develop diabetes, regardless of whether they take a statin, still include older age, increased weight, and higher blood glucose levels before statin use. Statins may be simply unmasking diabetes that would have developed anyway, based on these other very important risk factors. However, despite these major breakthroughs in our knowledge and treatment since insulin was discovered, The growing worldwide epidemic of diabesity in the early part of the 21st century has thrown many more troops into the battle with diabetes and macrovascular disease. Today, diabetes has become one of the commonest, serious medical conditions the human race has had to face. Thank you for listening.